Well, that's the problem. There aren't overwhelming good stories. And there are, don't get me wrong, there are overwhelming good stories, but people don't tend to talk about, yeah, I got immunized and I never got sick, right? That just doesn't happen because you
breathe in the gift of life. Breathe out the way you carry. May your body remember peace. May your spirit learn to rest. Body and mind made whole again. Good health to you. Good health to you. Good health to you. Good health to you.
If it's your first time around this neck of the woods, welcome. I am really glad you're here. This is a space where we explore the deep roots of the ideas that quietly shape our lives. Ideas that shape how we understand ourselves, how we relate to one another, and how we make meaning in our lives. Especially so during those seasons when fear, uncertainty, and mistrust begin shaping how we see one another. And we find ourselves asking what it means to care for human life, to care for community, and each other in meaningful ways. My guest today is a very close friend of mine, Christina. Christina works in the field of immunization and public health. In this conversation, I invited Christina to help us think through a topic that sits at a very interesting intersection: science, trust, community, responsibility, and ultimately what it means to care for one another. Now, the full spiritually grounded presentation and extended dialogue on vaccination is available on Patreon for reasons that are probably obvious. And honestly, I would encourage you to watch the full conversation there, because beneath the medical discussions are deeper human questions that affect all of us. Questions such as, how do human beings decide who or what to trust? What happens when trust breaks down? How do communities protect vulnerable people? And what does compassion look like in a world shaped by fear, uncertainty, and conflicting voices? Those questions are not only medical, they are spiritual, they are ethical, they are ultimately deeply human. So, wherever you may stand on these conversations, I hope you'll enter this dialogue thoughtfully, compassionately, and with a willingness to reflect. What you're about to watch here on YouTube are portions of our off-script conversation after the formal presentation. Now, let's step right into the conversation.
Hi, my name is Christina Smith. I'm the Regional Knowledge Coordinator for the Immunization and Informatics Program with Interior Health. I'm a registered nurse, and I've been a registered nurse for just over 20 years. And I got into public health nursing pretty much right away. And I was a public health nurse for probably the first 13 years of my career when I transitioned into more of public health leadership roles, working with communicable diseases, and also then now in my current role with immunizations. And I think the thing that really drew me into it is the autonomy of the work, the relationship building, and there's always something different, but you're connecting with people in a real way. You're not run off your feet like so many nurses are in the hospital, where they're just, people lying in beds and they're just, giving medications, and that's all they have time to do, maybe treatments. But in the work with public health, you get to, certainly connect with people and their day-to-day lives. And the work that I do now, I don't necessarily work with people. I work more with the public health nurses to support them to do that work, particularly with immunization work, helping them to navigate all the complexities of schedules and, when people have different illnesses, how to, ensure that they're getting the best protection possible. And I enjoy being a resource and passing all the years of knowledge that I have from the work that I've done. But I think the biggest thing for me that really drives me is trying to get public health back into the relationship building work that we have done traditionally for so many years. Like I talked about how I used to be in the community, baby groups, prenatal classes, all of those things are so important. All the work that isn't even putting a needle in somebody's arm builds the relationship, builds the connections where people trust your judgment. They ask you questions. They understand that when they have a relationship with you and that you care about them, that they trust your decisions or your information, and they're more likely to make a decision for immunizing. And if they have questions, or concerns, there's no you can't ask me that question. It's open dialogue. And I think that is what I love about public health nursing in general, but the work I do now in supporting nurses to have those relationships as well. It's a numbers game, really, and it's not something you can refute. When people don't believe in immunization, it affects community immunity or herd immunity because it requires a certain number, a percentage of the population to be immunized to protect others. So when people decide, well, I'm just going to leave the decision to other people to be immunized, I'm not going to do it. But if everybody makes that decision, then nobody will be immunized, or very few. Fortunately, the majority of people still do choose immunization. But when the numbers aren't, like for instance, for measles, you need 95% of the population to be immunized for community immunity to be reached. We have numbers, depending on the area, even within interior health, of, some areas are more around 50% or 65%, and that just doesn't cut it. So you have to, as a person, not just think about your own choice for yourself or for your immediate family, but to look beyond and see how your responsibility is to your greater community, to the school your children attend, to the church where you may worship, or the community center where you spend time doing different programs. So it's not just about you, it's also about those you interact with. So it's that saying, no man is an island. That really is that understanding with when we choose to be immunized, we're not just doing it for ourselves or for our loved ones, we're doing it for the greater community as well. I don't think there's one, smoking gun for vaccine hesitancy. It's a very complex, there's many reasons for it. One of the big things is, talking about people's early childhood experiences and the trust or mistrust that they developed, just some of that social understanding that we have from people like Erickson, who really have studied looking at those early life experiences and attachment relationships that people have. And when you have those healthy attachments where children learn to trust their caregivers, where their needs are met, then they tend to have more trusting, more stable social relationships later. But where those relationships are damaged, where their children have been traumatized, they automatically come with a more mistrusting spirit, if you will, because they've been let down by the people they should be able to trust. There are also other factors, certainly, that people, surround themselves with others who have had negative experiences, and that often plays a role as well. If others have, shared their views and you adopt them as well. It can be in families, it can be in a social circle or a religious community as well. But there are many, many factors at play that influence people's decisions on whether they get immunized or not, or whether they do anything, right? Well, that's a challenging question, because I think that, certainly individuals have very complex social and emotional histories, but we do tend to see that there tends to be within religious communities, not all religious communities, but there tends to be, especially in religious communities that are within their set of beliefs, they don't promote immunization. You'll see, pockets of those individuals who choose not to be immunized because of their church community's beliefs. But surprisingly, we also see sometimes very highly educated individuals, people who have master's degrees that are very, very highly educated, but not necessarily in healthcare, who, it's almost like you don't know enough, but you know too much. And you perhaps have been exposed to some other negative authority or area of government, or different other structures within our society that make you think, well, if whether it's big pharma or the food industry, or there's something that you can paint every industry with the same brush, and that's not always true. And I know that there was one time in my career as a public health nurse where I was accused of getting kickbacks, of that the government gives us money for every vaccine that we give, and certainly that's not true. Public health nurses are probably the most cost-effective way of giving immunizations to the population. But also, there have been also many other interesting scenarios put to my attention, like why the government wants the public to be immunized, that there's some nefarious reason for that. But really, I've always said the conspiracy is that the government wants you to be protected. They want to invest in you to prevent you from being sick, because they do want us all to be productive and make sure that we're paying our taxes. So it's more important for the government to keep you healthy and out of the hospital, which costs more money than a vaccine in an arm, and make sure that you're able to go to work every day like a good worker bee and bring home the money. So it's as dark as that. Well, that's the problem. There aren't overwhelming good stories. And there are, don't get me wrong, there are overwhelming good stories, but people don't tend to talk about, yeah, I got immunized and I never got sick, right? That just doesn't happen, because when you've been immunized, the immunization is doing its job. It's keeping you healthy. So there's no reason to report, hey, I stayed healthy. Whereas when somebody something happens, whether it is truly because of the vaccine or not, vaccines are an easy blame. And I know that part of my role is to report or to help with the reporting for adverse events related to vaccines for our health authority. And they're very, very like a drop in the bucket compared to the amount of immunizations we do give, where nobody ever has a problem at all. And even for those who've had an adverse event, to actually say, yes, it was because of the vaccine, it's hard to prove that. And, it's important, of course, to really help people understand, the risk versus the benefits. But, when people don't know, they tend to overreact about some of these smaller things. Like, for instance, that family who were worried about a fever. A fever is a very natural, normal response to vaccines, to illness. And it's actually very healthy. But we've been taught as a society to fear the fever because of risks in the past with fevers that have gone too high. But people tend to just right away give Tylenol or ibuprofen before, without letting the fever do its job in the body. And a vaccine related fever just shows the vaccine actually worked. It's engaging with your immune system to make sure that you are developing that protection. So it's actually a good thing. Well, the vaccine policy, as far as insurance, it really depends on the vaccine itself. For instance, your vaccine policy for tetanus and diphtheria is good for 10 years. So every 10 years as an adult, you should get a booster of tetanus, diphtheria. However, as a baby, to build that immunity, because tetanus-containing vaccines, which typically contain more than just tetanus and diphtheria, they can have other combinations of vaccine antigens. And so to build a baby's immunity, they tend to, that you have to have a series is what it's called. So at 2 months, 4 months, 6 months, and then 18 months, and then at age 4 to 6 years of age. And then after that, grade 9, and then every 10 years as an adult. So that's what it looks like for that particular vaccine series. And then you build it, from there, continuing. But for instance, for measles, typically, in the past, when I was a baby, it was 1-dose series was considered all the protection you needed. But then they found that some individuals didn't develop enough protection, and then they came out with 2 doses. So when I went into nursing school and they had found that I'd only had 1 dose of measles, mumps, and rubella vaccine, I had to get another one. But then that is it for life. It's all you need. Same thing with chickenpox. If you get the chickenpox vaccine, it's 2 doses, and then that's all you need. So it really depends on the vaccine. It depends on whether it's a live virus vaccine, which tends to give you long-lasting protection, whereas the inactivated vaccines, you have to boost them more regularly. But, for adults, fortunately for them, they don't need as many vaccines, of course, unless they develop some health challenges, which sometimes they might need some extra protection. I think it's rebuilding relationship. We've seen so many cuts to programs in, particularly public health, or just not keeping up with the population, and the infrastructure of public health nursing has declined over my career. I've seen it, but it was even before that time. And now we're sitting in a situation where we've lost a lot of ground in building relationship with people, to the extent that, we can't even get there without probably a huge infusion of money from our governments. But what I would do, and what I am doing in my work, is really trying to encourage nurses to understand, our leadership to understand that those things that we do, baby groups, the things that are done, like going out to a health fair, being at a farmer's market with a booth to share immunization, or even just public health nursing information, All of those things are not nice things to do. They are essential because we need to be building that trusting relationship with the people in our communities. And that takes time. That might take a whole generation to do. So it has to happen. It can't be something that is put on the back burner. It's something that needs attention now. It's not going to fit in any political cycle. It's something that has to be invested in over the long haul, and it has to start now if we want to see immunization rates improve, for the next generation.
Now, as is often the case around here, the deeper parts of this conversation, like all others, live on Patreon. In the extended talk, Christina explores the deeper human realities surrounding immunization, not only the science itself, but the questions of trust, fear, community, and what it means to care for one another. If that sounds like a conversation you'd like to sit with more deeply, I'll leave the link to Patreon in the description below. And as always, thank you for being here. Because learning how to think carefully, compassionately, and honestly about the forces shaping our shared lives truly, truly matters.